Happy Tuesday. Good morning. New mug today too. This one seemed fitting. Was very happy to find this one. And today we're going to be talking about doctors, so it makes sense to have the little doctor mug on this beautiful Tuesday. Good morning, everybody. So nice to have you. I'm just waiting for some to join. Hello, good morning. So we bought Pig all these new toys. Good morning, sunshine, right back at ya. We bought Pig all these new toys yesterday, and so now she has a big suitcase full of toys. And so we'll see, I'm sure there's stuffing all over the place because she's torn apart almost all of them as of yesterday. So very happy dog, for sure. Yeah, so it's Tuesday. I'm Dr. Trisha Pingel. This is your morning checkup. Just a reminder, I will not be here tomorrow live, and I'm so sorry, but I'm shooting some new content, and I'm way excited about it. And so I won't be here live, but we will. I'll put up a rerun, I guess. I'm going to be in rerun tomorrow, and then I'll be back live on Thursday. So sorry for any inconvenience on that, but I think you'll be excited to see what I'm working on. And so, it is what it is. I just won't be here. So sorry about that. But for today, so yesterday, well, let's start by talking about what we talked about yesterday. Yesterday, we talked about biochemical individuality and how naturopathic medicine lends itself really well to that, looking at everybody as individuals as opposed to looking at everyone as the same. And so I wanted to spend some time today answering the question, what exactly is naturopathic medicine? What is a naturopathic doctor? Because I get emails, messages all the time from many of you in different states asking where you can find somebody to help you, asking how you determine who's good and who's not, asking for recommendations. And so I wanted to give you a little background on what exactly naturopathic medicine is, what the degree is that's required so that you can look at people's websites in your area and you can determine who has the appropriate training and who doesn't. Unfortunately, the term naturopath is thrown around a lot, and it doesn't always mean the same thing. So I want to talk about that a little bit today, talk about what I love and why I went into this type of medicine as well. So hopefully that's of interest to you guys. Good morning over there on Facebook. Good morning, Kelly, Leah, Arthur. Good morning. Dr. Mug today. I will also say I have some palm tree trimmers outside my door this morning, and hopefully it won't disturb you too much, which a bunch of sawing on top of Piggy's grunts back there as she eats a different toy this morning. So anyway, let's dive in. So I want to start with some stats in general about naturopathic medicine, and then we'll go into what is it, why did I go into it, what are the qualifications, what's the schooling, and some of the questions that I get asked on a daily basis as people are trying to find somebody to help them with their health. First of all, about 40% of adults in the United States use alternative medicine or some sort of naturopathic medicine. 40%, which is a good amount, and about 10% of children. Which is unfortunate. I think we have a real window there of catching a lot of issues in childhood. So I'd love to see that number go up. But 40% of adults, more likely women, although I have clientele that are men as well. I think a lot of the times I see the wife and they bring the husband, so I end up getting both at the same time. But yeah, primarily women. I'm asking about a naturopathic doctor in Michigan. Bear with me, Arthur, okay? Bear with me. I'm getting there. The top areas that most people see naturopathic physicians for are primary care, women's health, aging, and digestive disorders. Those are the top three. Of course, we see far more, which I'll get into, but those are the top ones. But other ones that are commonly in naturopathic offices, we see a lot of allergies, asthma, cardiovascular disease, a lot of cancer, chronic pain, diabetes, infertility, Lyme disease, viral illness, that type of thing. many patients, especially the seniors out there, especially the ones over 65, would like their conventional doctor to try more natural approaches before jumping to pharmaceuticals. And I agree with that too. Now, a lot of people ask if I prescribe. Yes, I can, but I think it comes down to when it's needed and when it's not. And if there's an option of not prescribing a pharmaceutical, there's an option of a natural option or a lifestyle option, that's what I'm going to lean towards. That's not always the norm, right? So a lot of my senior clients as well, that's their number one concern, right? They really want to try natural options, and that's great. Now, as of 2018, there were 28 major health systems, hospitals, and cancer treatment centers that had at least one or more licensed naturopathic doctor on staff, which is great news. I'd like to see more, but that's great news. And about 6,000 licensed naturopathic doctors practicing in the United States. Piggy has lost her ball. There we go. What? Get off your bed there, girl. Go get it. Go get it. So that's great. And then as of, I think currently right now, there's 22 U.S. states, plus the District of Columbia, Puerto Rico, and the U.S. Virgin Islands that license naturopathic doctors. So naturopathic doctors are licensed by state. We're not federally regulated, we're state regulated. So depending on what state you're in, has different laws. Here in Arizona, we're fully licensed. We have a lot of options here in Arizona. We have a lot of different things that we can do. Other states, not so much. So it's important to know what state you're in, and then it's important to do your research because there are many people who are well qualified to take care of you in unlicensed states. You just have to know what to ask. So we're gonna go into that, okay? So what I do love, going back to the number about hospitals incorporating naturopathic physicians, is I'm loving the integrative aspect of it. I think that all of us doctors have, and I talked about this yesterday, but all of us have a certain specialty. We all have a certain area that we really focus in. And if all of us could come together and communicate and work together, I think our health as a nation would drastically improve. I think taking the values of what I've learned and combining that with values of what other people's learned would be so helpful to everybody, and I wish that it was more integrated. And we'll get there. I think all other doctors have gone through this process as well. Chiropractor doctors, doctor of osteopath, they've all kind of gone through this process of licensing per state to become more well accepted, and naturopathic physicians have a great trajectory of most states, adding on. We have more every single year. So it's just a matter of time. But it would be nice if there was a little bit more integration, I think. And in the areas that do have that integration, I've seen some amazing, amazing benefits. The patients are definitely benefiting from that. Hello to all of you that just joined. Hello. We're talking about naturopathic medicine today. My life, my heart. So, I do. I love it. I love the discipline in general. So what's the difference though? What exactly is it? What is naturopathic medicine? Do we go to med school? All these questions that people ask, I'm going to get to, I promise. So naturopathic medicine focuses on the body's innate ability to heal and supporting the body in order to encourage that healing, as opposed to just simply suppressing a symptom. Okay, so we can suppress symptoms as well. Herbs can suppress symptoms. Nutrition can suppress symptoms. Like I said, I can prescribe medications that suppress symptoms, but the goal is to also be building up the body's natural ability to recover and heal, because we have that, in a well-functioning body. Unfortunately, we have a lot of external factors around us. We have a lot of stress, we have a lot of toxins, we have a lot of poor food, we have a lot of things around us that can cause problems and disrupt our normal natural ability to heal. So bringing in the aspect of naturopathic medicine to the scene allows us to try to repair those underlying issues so that we have less disease development. And that's really what we do. We look for the root cause. We find where is the problem that caused this disease to happen, okay? And we work on that. Now, that's easily intertwines with the traditional model as well. If they're working on suppressing symptoms, we can certainly work on building up the body to lower those symptoms over time as well. So there's a lot of different aspects that we can all work together on. Piggy. Did she lose her ball again? Piggy. Try this one, Pig. Try this one. Ready? Go get it. She's crazy today, guys, this little dog. So when we look at the guiding principles of naturopathic medicine, we take an oath when we graduate medical school, just as any other physician does. And it is first, do no harm. Number 2, the healing power of nature, meaning trusting the body's natural ability to heal. Identify and treat the cause. Okay, not identify and treat the symptom. I'm saying identify and treat the cause. Okay, can I talk about vitamin A and Alive? Sure, let me write that down. I'll get there, I'll put it on the list, okay? I'll work on an article on it too, okay? So where was I? Identify and treat the cause. Doctor as teacher. I think doctor as teacher is why I'm here right now. Because I like to teach patients. I like to teach you what your body is telling you. It's kind of like a language, right? When you have a new baby, you have to learn that baby's language. You know, you have to figure out which cry is hunger, which cry is tired, which cry is cranky, which one has a stomach ache, right? I've got to learn barks from my dog on what she wants. Like right now, I know that bark means that her ball is underneath the chair, and she's not going to let it go till I go get it, right? But you have to learn that language. Well, your body gives you a language as well. It talks to you. It tells you what's going on by symptoms, but you have to be aware of it. If you're not paying attention, you're like, oh, I'm just tired. Well, that tired means something, you know? So if you're really tracking and you're looking at it, you can actually pinpoint what the body is trying to say. So that is why I educate. That is why I teach. To teach you what to watch for, to teach you what to pay attention to. And doctor as teacher is a huge aspect of naturopathic medicine, and an area that I don't see as much in conventional medicine. I do have some. Please don't think I'm knocking it. I know some MDs that are phenomenal. I'm just saying in general, I don't always know that they have enough time to teach. You know, it's a lot of pamphlets and handouts as opposed to question and answer type things, which is valuable. I think that's valuable. Treat the whole person. Naturopathic medicine, we take an oath to look at the body as a whole unit, okay? As everything connected, mind, body, spirit. This isn't, you know, you don't go to the psychologist for your brain, and you go to the endocrinologist for your hormones, and you go to the GI for your GI problems, and you go to the allergist for your allergies. No, they're all connected. Everything is a whole. And it's like a domino effect. So when you knock one domino down, it's going to scatter throughout the rest. And our body is that way. And we take an oath to treat it that way. And then lastly, prevention, which focusing on preventative care, ways to prevent disease and build the body to be stronger to resist disease when it comes about. You know, that plays into our times right now. You know, why do some people have a minimal reaction to a certain virus, and why do others have detrimental effects? You know, the body matters, right? The virus kills or affects everybody differently. So why is that? You know, it's because all bodies are different. We all have a different underlying foundation, and we have to support that. Piggy, goodness, child. Pardon me. If you keep losing your ball, there you go. Okay, jump. Show everybody, huh? No? Okay. Oh, goodness. She always interrupts, doesn't she? Oh, Piggy and her toys are one of the best things from Dr. Tricia Pingel. Well, I appreciate that. Thank you. You know, many would say to let her out of the room, like be like, let her be, she distracts you, but I find her hilarious. And sometimes my talks, you know, I'm talking about a lot of different things, so sometimes it's nice to kind of break the brain and go pick up a ball and throw it for the little oinker, you know? So those are the guiding principles of naturopathic medicine. So why did I become a naturopathic physician? Why did I choose this route? You know, many of you may have seen this. I do have it on my YouTube page, my story, my general story, and I won't go into length at it. But the bottom line is I spent many, many years with little symptoms, you know? Things that weren't enough, I guess, to warrant treatment, but were enough to impact my life. And I was just told I was healthy all the time. And nobody really took time to investigate it. And then when so what later in life, when I found naturopathic medicine and it changed my life completely, it really concreted and cemented for me that you have to investigate even when you're well. You have to look at things when you're well. My dad, Piggy just saw the workers cutting the palm trees. Don't bark, Piggy. It's okay. It's okay. When I was 24 years old, my dad had a stroke. It was fatal. It was sudden. He was in a coma for 2 or 3 months, and nobody could tell us anything. At the time, I was going to become a veterinarian. I was getting my undergraduate degree in biology with the intention of going to school as to become a veterinarian. And I was working as a vet tech, and I really enjoyed veterinary medicine because there's a lot of diagnostics in there. You don't know what the patient can't tell you anything, so you really, really have to focus on diagnostic medicine, which I love. And I kept asking the conventional doctors, what's going on? Just tell me. Like, is he going to make it? Is he not? We can't really tell. Does he hear us? Does he not? Well, we don't know. We just don't know. Well, we don't know. And where has it been impacted? I mean, I actually had to ask to go look at the MRI to get any information. I'm the one that read the MRI report so that I could educate myself on what part of his brain was even impacted. The doctors didn't even tell me that when I asked. And I remember being so frustrated, and I thought, my dad was a smoker, okay? And he was a musician, and he would go into the local little bars around, and he would play guitar, and he would smoke, and but he was on cholesterol medication and blood pressure medication, and he had just had his angiogram, and he had had his cardiovascular workup a couple months earlier, and they said, oh, you're great, your cholesterol numbers are your cholesterol numbers are in line, your blood pressure's well controlled, you're good, we'll see you next year. And 2 months later, he went into a coma and did not survive. And, that's one of the things that clicked for me, is it's not about the numbers. It's not about whether you're controlling the symptom correctly. It's about, are you repairing the damage, right? Nobody was repairing the damage. And, they kept saying, oh, you need to quit smoking. Okay, yeah, but there wasn't really any assistance for him to do that. So I started to see that there's a whole area of medicine, and as I learned more about natural medicine, I learned, about methylation, and I learned about how smoking blocks methylation, and I learned about MTHFR, which our family has, as I found out later, which likely was to his demise, was a genetic mutation that blocks folate, and when you smoke on top of that, you block folate further. It frustrated me, and I think it opened my eyes to the fact that there isn't enough education in general to the patient or the patient's families. And there's a lot of things that we can do preventatively and investigatively ahead of time before something as drastic as that happens. And that's where I ended up in naturopathic medicine, and it felt like home. And I'm happy that I did. I do sometimes think, oh, well, what would have happened if I would have become a veterinarian? I'm sure it would have been great, and I'm sure I would have loved it as well. But there's been so much more passion and so much more growth of me as a person being and treating humans and hearing people's stories and learning from them, and how many other people that I have met that have had a similar situation to me. So losing my dad, as tragic and as awful as that was, to sit there next to him in a coma and have no idea what's going on, was a door that opened to what I was going to end up doing that I hadn't even considered in that moment. And so I always say to you guys, and I say to my patients, and I say to my kids, with tragedy and with loss comes a door that opens, that allows for massive growth. So try not to wallow too much in the negative, and look in a negative situation for that door to open, because it will happen. You will grow through tragedy at times, and there'll always be another tragic event that will happen as well, and then you have to grow from there. So that is why I became a naturopathic doctor. Anyway, still went longer than I thought. So what is a naturopathic doctor? So there's a term that gets thrown around, naturopath, right? And naturopath could be a naturopathic doctor, or maybe someone who just has a certification in naturopathic modalities. There is a difference, okay? So for those of you, whether you're in states that license naturopathic physicians, or for those that don't, I was just asked about Michigan and with other areas, I think Michigan is pending a bill of licensure right now, so that will be soon, and you're welcome. I'm happy to share stories. I know I've talked about my mom and her passing of cancer recently, but I haven't talked much about my dad, but he was a good dude. I wish he was still here, but look at the door that opened, so it's okay. But Michigan is license pending, just for the person who asked about Michigan, so that might come along in 2021. There is a difference. So in order to be called a naturopathic physician or naturopathic doctor, you have to actually have a doctorate in naturopathic medicine. Now, there are programs out there. There are add-on programs for other doctors. Let's say if you're an MD and you want more training in naturopathic modalities, there are certifications for naturopathic modalities, for herbal medicine, those types of things. They can't label themselves as an ND or an NMD in that respect. They cannot, because they don't have a naturopathic medical degree. They may have a medical degree with training in naturopathic modalities, and that's great. I think anytime we add more natural modalities into training, that's great. There are also online courses for people that do not have the background, the scientific degree or the bachelor's or anything that allows them to become health coaches or consultants, and they can call themselves a naturopath. However, they cannot call themselves a naturopathic doctor. Now, just to confuse things, you're going to have naturopathic doctors that are in states that are unlicensed where the state won't let them say that, but they actually are naturopathic doctors. So let's talk about what is a naturopathic doctor. So naturopathic doctors complete a 4-year in-residence degree program, postgraduate, that's accredited by the Council on Naturopathic Medical Education, okay? So there are 7, I believe, I haven't checked in the last couple months if anything's changed. I believe there were 7 accredited naturopathic medical schools across the United States and Canada. I went to the one here in Arizona, Southwest College of Naturopathic Medicine. Another there's Washington has one, Oregon has one. There was one in Connecticut. I'm not positive that's still there, and there's a few in Canada. So these programs have at least 4,100 hours of instruction plus 1,200 hours of supervised in-person clinical training and rotations with patients. We are required to sit for the naturopathic physician's licensing exam. Okay, so it's a board exam. The board exam is pretty intense. For me, I had 2 different ones. So I had one after year 2, and I had to pass it in order to go into clinical rotations. I was not allowed to touch a patient until I had passed the first set of board exams. The first set of board exams were anatomy, physiology, biochemistry, microbiology, immunology, virology. There might have been one more, but I had to pass those in order to go into clinicals. Once you go into clinicals, and then you, when you graduate, you go through another board exam. Mine was 3 days. It was miserable. But part 2 includes far more. Herbal medicine, nutritional therapy, pharmacology, physiology, biochemistry, physical medicine, acupuncture, minor surgery, homeopathy, pathology, anatomy, diagnostics, lab interpretation, clinical case studies. Did I mention homeopathy too? Yeah, I did. Okay. I mean, it was ridiculous, okay, how long it was, but very comprehensive, and I'm glad. That's a good thing, right? We always want to do that. And then you also have to do a clinical examination board exam where you're actually examining a certain amount of patients. You have to be graded on your ability to interact with patients, your ability for physical exam, and those types of things. So many people say, are you truly a doctor? Did you really go through medical school? I did. And I was required to have an undergraduate degree with certain prerequisites. So for me, I have a degree in biology from Arizona State University. And then I had to go on to this 4-year postdoctorate program, which was very, very intense. So if you think about it, people say, well, what did they do in conventional medicine? We kind of focus on different things. However, I had to learn that too. I had to learn pharmacology. I had to learn diagnosis. I had to learn physical exam. I had to learn minor surgery. I had to learn all of these things that they do there. But on top of it, I also had to learn all of the naturopathic therapies. Botanical medicine is a huge area There are so many drugs out there in pharmacology, but what blew me away was how many herbs there are out there too. Holy Toledo. And having to learn both of those and then learn how they interact was another aspect. So when people, get a certification, they learn some of this, okay? They do. And I think it's always helpful for people to learn about naturopathic medicine and certify and grow their career. But if you're looking for a naturopathic physician, what you want to do is you want to see if that person graduated from one of the accredited naturopathic medical schools. That's how you'll know if they had the same training as I just mentioned or not. So that's what you need to look for. Okay, so people say, how do I look? Now there is a website by the AANP, naturopathic.org, where you can search for naturopathic providers in your area. Not all of us are listed. I mean, I'm not listed on there because it comes down to paying to list yourself and whatnot. But you cannot be on that website if you have not been to an accredited naturopathic medical school. So it's always a very good start. If the doctor that you are seeing or you're looking up online isn't on their list, that's okay. But read their website or call their office and ask where they went to school. Simple as that. If they say one of the accredited naturopathic medical schools, you should be pretty good to go. Okay? I'm glad you're loving this. I didn't know on this topic, would people really be interested or not? But I think there's so much training in this type of medicine. And, I think naturopaths are generally well accepted now, but naturopathic doctors are generally well accepted now, but a lot of people don't realize the training. They say, oh, they're not true doctors. I am, and I worked my butt off to get it. And I have the student loans to show it. And that's okay, because that's what I wanted to do, right? How do I encourage my daughter-in-law to learn how to help her future patients naturally? She starts medical school in the fall to become a doctor. One of the things I would recommend, depending on what area she's in, is maybe do some of her clinical rotations in a naturopathic clinic. We have here in Arizona, I can speak to because I went to the school here. There's an actual medical center on campus that's all naturopathic, but you're also very much encouraged to work in other modalities during your 4th year. So I would go out, I went to San Diego and I worked under traditional pediatricians. At Kaiser Permanente. And I watched the conventional model. I worked with an ear, nose, and throat surgeon. These were non-naturopathic people. But I went in there to help learn from them, and hopefully they learned from me as well. And so I'm pretty sure in the traditional medical school, you might have an option to do off-site rotations. I would encourage her to check out doing rotations with naturopaths, just to kind of learn from them. Yes, you do have one in Oregon, national, Portland. So hopefully that helps. Anyway, hopefully that helps answer your question. But I just say, the more that we can educate ourselves on each other's, the better. I really enjoyed working for an ENT surgeon. I really enjoyed going and really hearing his perspective on things. It's not something I do. I don't do surgery. I am certified and licensed in minor surgery, meaning that I should be able to remove moles and toenails and things like that. I've been trained in it. Not something I really enjoy doing, and nor do I do much of. I wouldn't come to me to remove your toenail because I don't practice it much anymore, but I'm trained in it, right? So it was cool to watch him in surgeries and learn from that. I also did some rotations with cancer. Pediatric cancer in San Diego was ridiculously hard. God, my heart goes out to those people that can do that. But, I think it's important for all doctors to look at all different areas and learn from them. I did some acupuncture rotations. I did all sorts of different rotations and tried to be to learn from everybody in some way so that I could narrow down what I wanted to do. Now, many naturopaths will also do a residency program after school. And that's very common as well, where they can narrow down their discipline. So it's not required. There's a couple different ways you can go about it. I did a lot of that during my actual 4 years. I took on a lot of extra clinical rotations. And it was great and very helpful to me. Other people may choose to do a residency program. Otherwise, it's kind of your own personal choice. But anyway, so that's the difference. Does that make sense? Everyone following? Hello from South Dakota. Well, hello from Arizona. So do naturopathic doctors have a medical degree? Yes, we do. And we're proud of it because it was tough. So that kind of answers that question. Let me see if I have any other questions that people ask. What do we treat? We treat everything. Now, many of you have been following me. I'm very, very entwined in the endocrine system and gastrointestinal system and nutritional therapy. Those are things that I'm very passionate about, things that I like to incorporate. But with that, I'm also primary care. I see a lot of other things as well. What do I think about Dr. Pimple Popper? I have the hardest time watching that show. My husband and kids love it. It's on all the time, and I'm walking through to the kitchen and I'll see it. I'll be like, oh. And what's funny is that my husband always looks at me and says, honey, you're a doctor. Like, this shouldn't impact you at all. And I'm like, yeah, I don't need to watch that. Does insurance cover naturopathic medicine? Depends. I know that in Washington and Oregon, most insurance plans do. Here in Arizona, we have one that covers naturopathic medicine. I think it's Cigna, but we also can bill labs and stuff to independent insurance companies. So a lot of the times, we can send a lab order to a lab that's contracted with insurance, and insurance can cover that. I personally don't take insurance for office visits, and a lot of naturopaths don't, just because we can't see as many people. But there are some insurance benefits. In other states, there's none. I mean, it's kind of hit or miss. For me, I think overall, your output of money is less over time. It may be more upfront because you're paying for office visits and seeing someone regularly, but if we're preventing disease, we're preventing surgeries, we're preventing, chronic diseases that will have you going into the doctor all the time with copays and MRIs and surgeries and things like that. Over time, we're actually your output in your health costs is going to be less because we're going to teach you how to do a lot of that, maintain your own health at home, and have less overall problems in the future. When I look at the amount of money spent on diabetes or cancer or heart disease in the traditional model, even though it's running through insurance, the healthcare dollars that go into that far surpass what it's going to cost to pay a naturopath out of pocket for an office visit. So I look at it in the long term. A lot of people, I realize, they need to use their insurance, and that's just the way of life. Some people just simply cannot afford to pay out of pocket. But I do think if you can, it's a great investment, especially if you find someone that you really trust and can have this communication and this relationship with. I think it's a great investment. I know for me, I've lowered my healthcare costs dramatically just by taking care of myself. My family, really, we don't use them. We have insurance, we don't use it. How do I treat SIBO? Oh boy, that's a big one. I think I'm gonna have to save that for a different day. Once again, though, I will say that everybody with SIBO has a different presentation. Nobody's the same. I have yet to find a single SIBO patient that I have treated identical. They've all had some sort of modification depending on what bug is overgrowing, what their diet is, what their lifestyle is. You have to look at feeding the right bugs at the right time and killing the right bugs at the right time. That's kind of my summary. So everyone's very, very different. So with that said, it leads into my next question, or my next point is, how does a naturopathic doctor diagnose illness? And I think a lot of people think we're excessive. They think we run too many labs or run too many things because they're not warranted by the little flow chart that I talked about yesterday, where, once you have a certain thing, yes or no, goes to here, yes or no, yes to here, and then you can run these labs. I tend to be very proactive. I like to once a year do a really good lab workup and compare it to the year before and compare it to the year before, and see where all these small little changes are. One of my best examples is that disease happens in a fashion where you're healthy here and disease is over here, and there's this whole pathway to that disease. And when you repair disease, it goes back the other way. That's why a lot of the times you revisit some of the symptoms that you've had in the past. So if disease is a slow progressing thing, you don't just wake up one day with the disease. Diabetes is a great example. Your blood sugar may be 88, and then the next year it's 90, and then the next year it's 95, and then the next year it's 98, next year it's 99, and then it's 105, and they go, well, you're pre-diabetic. And you say, I don't understand. What do you mean I'm pre-diabetic? I just was normal last year or 6 months ago. I don't understand. Oh yeah, well now you're pre-diabetic. Now we have to treat you. Well, if they would have noticed the trend over the years, we could have started treating sooner, right? So that's what we do. That's why we do all these labs. I mean, I think that's one of the concerns that people have is they say, well, geez, you took like 9 vials. Well, yeah, because I want to catch things before they happen. So looking at the body holistically requires a lot of investigation. It requires a lot of investigation of everything that's connected. And that's how a lot of us do it, as well as just listening. And taking the time to listen and monitor symptoms, I think, is a huge part of naturopathic medicine as well. Hello, you're late today. I'm starting to get to know all of you out there, huh? I know when you're here or not. So anyway, that is kind of the overview of what naturopathic medicine is. And it seems like you guys were enjoying this one. So it's so nice to have all these questions. I tried to catch all of them. They kind of fly past my screen, and sometimes it's right in the middle of when I'm saying something. But, I'm glad that you guys found this entertaining. Naturopathic medicine is very close to my heart. I feel that there's a huge future in it. I feel that there's a lot of room for integration. And I think by all of us just kind of recognizing it, understanding what it is, and considering it, we're all going to end up being healthier in the end. And I'm kind of excited to see what the future of this medicine is. So I have a couple more questions. Compounded probiotics. Is that good? Depends. I'm not sure. I mean, it kind of depends on what's in it and what your general health is. If it's multi-strain, more than 50 billion, and sustainable, like it doesn't die off quickly, then yes. Those are the things you have to look at. I actually have an article on probiotics at drpingel.com on how to pick a good probiotic and the things that you should ask when picking a probiotic. So maybe that would be helpful to you on deciding whether or not it's a good one for you. Oh, I am losing my connection, so good timing. Is a holistic medicine practitioner a choice if no close ND? Well, I think it's always a good idea to take a look at people who have been trained in holistic medicine. So you're really going to have to look at that individual person, see what their training is, meet with them, and decide whether they're a good fit for you. If there are no naturopathic doctors in your area, then obviously you don't have a whole heck of a lot of choice there. Good help, but have hypothyroidism. I have a whole live on hypothyroidism. It was a few weeks ago. Definitely have a lot of articles, a lot of information on that. My program goes pretty in depth on thyroid. Thyroid is something I treat regularly, like daily. So that is something that I'm very, very invested in. Treating migraine headaches. Yeah, I have some articles on that as well. You guys need to go to drpingel.com, read some articles. Tell me if any of those are of interest to you. I'm working on embedding these lives and videos into those articles so you can kind of have them all at once, but that takes a little bit of time, so bear with me. YouTube has a bunch of these videos as well. I am being asked on Facebook about homeopathy. I was trained in homeopathy. I use it acutely, regularly, but people that use homeopathy typically are 100% in homeopathy. It is such a complicated discipline. So it's not one that I use overly regularly. I don't know if I'll do a live on it just because I don't know if I'll do it justice. But I do have, I do mention some homeopathic remedies and stuff on my website. It's a huge area of discussion, and there are people that spend years and years and years training in homeopathy. So I think it could be a very valuable tool if the right practitioner is prescribing it. Wow, we're getting all sorts of questions. What is the name of my book again? Total Health Turnaround. If you go to drpingel.com, on the top, there's a link that says bookstore. Click on it. You'll find it. Do I have anything on gut health on my website? Absolutely. I absolutely do. Absolutely. I see a ton of gastrointestinal conditions. Very passionate about it. For those of you that have watched my lives on it, I've struggled with GI issues my entire life. So to heal myself and heal people from GI issues is huge. Thank you. I appreciate you ordering my book. Thank you. You can find it on Amazon, but my website will take you directly to it, so you don't have to be searching and hiding and finding it. Total Health Turnaround. So go to drpingel.com, click on bookstore. I do also have a program, Total Health Turnaround program, which goes in more extent on how to treat your body if it's been exposed to stress, hypothyroidism, gut health, neurotransmitters, insomnia. Oh my gosh, you name it. Check it out. See what you think. Right? So anyway, you guys have had a ton of questions today. How fun. I love it. I think I might need to do a Q&A soon. Would you guys like that if I just came on and let you ask me questions? I mean, there's some limitation to that. I can't give direct medical advice, but I can give general medical advice or point you in the right direction. So maybe we'll have to hook that up, because you guys have been great today with lots of questions. So really nice to see you all. Once again, just a reminder, I will not be here live tomorrow. It will be a rerun tomorrow because I'm shooting some new content, but the new content will be well worth it. So check out Facebook and Instagram tomorrow. There should be a replay, and then I will be back live on Thursday. All right, guys, much love to you. Piggy has passed out, so I'm going to go take a few minutes of quiet. Have a great day, guys. Bye-bye now.